It's a beautiful sunshiny day, and maybe we can all just kind of make a fresh, new, clean start, think of it as the spring, and get all energized, learn about fatigue, and then go on. So my talk of this presentation is going to focus on fatigue, getting from slow to go. The topics of today's talk are going to include the basics of fatigue, and as you can see, it's divided into what we call the primary factors and the secondary factors, and we're going to identify ways to address fatigue and MS. I thought that it would be very important to discuss the underpinnings of MS. The underpinnings are known as the pathophysiology of MS, and not on too scientific a level, but just in a way so that you can understand that the central nervous system is really a very busy place. And because fatigue, as we'll discuss as we go along, is a little bit not well defined, some people may say, gee, I feel this, I feel that. I'm not even sure if this is real. I would like to show you, based on this pathophysiology, that disruption to the signaling that occurs in the central system, the central nervous system, disruption to the signaling and the production on energy pathways on the cellular level is going to manifest in the body itself. And so that's what we call the pathophysiology of MS. And you can imagine the consequences of having such disruption can affect your entire life. So what do we know about fatigue? Actually, it's reported as the most common complaint of MS. And I'm not sure if you knew that, but up to about 75% of all people with MS complain of fatigue somewhere along the line. And even so, this is of a higher prevalence than pain or other causes of physical disability. And in being the most common debilitating symptom or complaint, we realize that it can affect your entire life, your work life, your home life. It can cause lost hours at work, and some people have had it affect their whole socioeconomic lifestyle, such that they've even lost their job from having too much fatigue. And it kind of goes hand in hand with depression, such that depression can seem to worsen fatigue, fatigue can seem to worsen depression, as many of the symptoms are very similar. And we'll talk about that a little bit later as well. So what is fatigue? Some people just describe it as decreased energy, decreased physical energy, decreased mental energy, just an overriding sense of exhaustion. Some people may complain of a motor fatigue. Some people just really can't describe it very well at all, just they know when it's there. And some people may say they just feel tired. So it's important when discussing this kind of feature to determine if it's sleepiness because you're not sleeping correctly, is it a motor fatigue, is it some kind of emotional fatigue, and each person has a different understanding, perhaps depending on their own cultural background, and how to describe this. So it's important in communicating with your caregiver that you explain what it is that you're feeling. We have scales, we have they're called self-assessment tools that can measure fatigue, but these scales don't really describe it. They just kind of indicate to us how much fatigue a person has. So that's not very satisfactory either. Now, in talking about what I call the underpinnings or the basics of MS, we understand today, to the best of our knowledge, that MS is an autoimmune disorder, and autoimmune disorders target a specific organ. So in MS, the organ that's targeted is the central nervous system. As you may or may not know, there are 3 nervous systems within the body. There's the central nervous system, which is the brain and the spinal cord. There's the peripheral nervous system, which are the nerves that come out from the spinal cord and go to the arms and the legs. And then there's the autonomic nervous system, which is a subset of the peripheral nervous system, and that works with the organs and the gut and the internal workings of the body. MS is also a neuroinflammatory disorder, And we might be more familiar with inflammation that you see on the outside of your body, for example. So if you fall down, if you have an abrasion, if you burn yourself, if you cut yourself, the skin turns pink or rosy, it may feel hot, it may get swollen. We know that kind of inflammation for sure, but how can you define inflammation in the brain? It's not something that's readily visible unless we use technology, MRIs for example, and know that it's occurring. And all of this process leads to what we call demyelination. So the autoimmune targeting the central nervous system in an inflammatory environment creates demyelination. So this is an attack upon other nerve cells within the brain. They're called oligodendrocytes. They attack the myelin, which is the sheath around the nerve, and cause demyelination. So that's kind of the full, very basic picture of MS. And we'll talk about each one of these things, and we'll see how altogether this manifests as fatigue. What are the key players in? So we'll start with the immune system. In the autoimmune system, there are in the immune system, there are several molecules and cells involved. We know within the bloodstream, there are red blood cells, there are white blood cells, there are platelets. Among the white blood cells, there's a group called lymphocytes, and these are divided into T cells and B cells. Among the important ones in an autoimmune process such as MS are the T1 cells, the T2 cells, the Th17 cells. The B cells, these have a role in antibody production. And then there are other players, something called antigens, cytokines and chemokines. We'll talk a little bit more about the cytokines, and a host of all other types of cells going on. So I thought I would just show you on a cellular level what these cells look like. Anybody recognize what this one is? That's a red one. How about this funny looking one with all the little, this is a lymphocyte. Yeah, so this one here, this plays a really significant role in MS. So this is all going on in your bloodstream right now, even as we sit here. So the cytokines and chemokines, and these are proteins. So a cytokine is a very small protein, and it's something that affects the behavior of another cell in the bloodstream. Whereas a chemokine is in that subset, it's under that category of a cytokine, and that's an attractant protein. So I was trying to come up with an analogy, and I thought, for example, like a flower that emits a fragrance would be the chemokine. The bee or the person picks up the fragrance and knows to go and enjoy that, the bounty of that particular flower. So a chemokine is more like a messenger, where a cytokine is a small protein that affects the behavior of other cells. And the reason that we're talking about all of this is that these are the players in that inflammatory response, and that inflammatory response is going to lead to disruption in the signaling, and the disruption in the signaling is going to lead to fatigue. Okay, so there we got it. It's like this is the house that Jack built. Okay, so everybody has immunity. I mean, organisms have immunity, and an immune response is that response made by an organism to defend itself to something that's coming in that's going to do some damage. And so that's a normal thing. We all have that. That's present in our blood. However, we're made such that we have something called self-tolerance, so that we don't attack the parts of our bodies that we're not supposed to attack. So we attack, the bad guys, but not the good guys. And for the most part, this system works pretty well. Our bodies behave, we attack the viruses and the bacteria coming in, and we leave the contents of the rest of our body alone. So in talking about autoimmunity, I said to myself, okay, let's talk about autos. So if somebody had to name a high-performance car, what would you come up with? A Corvette. What do you know? Okay. And I have no allegiance to Corvettes at all, believe me. This is not like a sales pitch for Corvettes. And then if you had to think of your old, standby, reliable car, the car that's going to get you there, it may not be too fancy. I'm sure you could come up with any brand of car that you like. But the whole idea is that in a central nervous system disorder, especially an autoimmune disorder, this is just kind of a memory device, there's a lot of redundancy in the central nervous system. So your brain is filled with 100 billion neurons. And not all of these neurons are responsible for a particular function in your body. Many of them are, but many of them aren't. And so we talk about what we call eloquent and non-eloquent brain. And that's why MS is very, as Dr. Green often calls it in our conversation, she calls it a sneaky disease. Because you can have an MS attack and maybe you don't even know it because it's affecting a part of the brain that really doesn't control something very specific. But if you go on years and years like that with one attack and another attack and another attack, sooner or later you'll feel that in your body. If these autoimmune attacks occur, there's going to be some disruption in the signaling on the pathways even if you're not feeling it at that time. And so instead of thinking of oneself as having problems, I thought maybe we could kind of introduce the idea that one becomes like a very streamlined, high-performance car because you get rid of the baggage, you get rid of the excess, and now you're operating on pathways that you're going to want to keep as intact as you can. And that's what our job is, to help you through this process and keep those intact pathways going. And then become, with that kind of streamlined approach, have the function of an everyday car so that you're not in the shop like these fancy cars do, but that you work very well with what you have because of all the medications, the lifestyle, the pharmacologic and non-pharmacologic assistance that we can describe and offer. An autoimmune response is, on the other hand, instead of the immune response which is wanted, it's an unwanted response to the body's own cells and own tissues, and that's where the damage is done in these autoimmune responses. And an autoimmune disease is what we call multifactorial. It's not just one cause. There are many things that cause an autoimmune disease, and we think it's a combination of genes or your genetic susceptibility to it, a breakdown of that tolerance. So when I was describing tolerance before, tolerance is that ability to not attack parts of your own body. So something happens with that system such that you do start to attack parts of your own body, in MS, the central nervous system, and then some environmental trigger on the outside that kind of sets this all off. We don't know if it's low vitamin D levels or exposure to some other virus, Epstein-Barr, but this whole combination of events creates MS. And here we can see these factors coming together. Going back now along that list, so we're talking about the basics of MS still. We're talking about MS as an autoimmune disease, organ specific to the central nervous system, and now we're talking about neuroinflammation. So we presented some of the players. We talked about cytokines, we talked about chemokines, and these are mediators, or these are the messengers of inflammation that cause it to happen. We talked about how it can cause demyelination. This whole combination of factors attacks components of that myelin sheath that surrounds the axon, and causes, in effect, what we call a catabolic state. So instead of building up, energy production is kind of diminished and leads to neurodegeneration if we don't kind of address each one. Now, the demyelination itself, and just to talk briefly about it, as you know, the way signaling occurs in the central nervous system is that there's a neuron, these 100 billion neurons that live up in the brain. From each nerve cell body, there's a long fiber that's wrapped in myelin. But the way the myelin wraps, it wraps in small segments so that there are spaces in between where there is no myelin, and that enables the very fast conduction in the nervous system. This is the type of cell that does the wrapping, and here's the axon that you can see peeking through, and this blue area here is the myelin. So what happens in neuroinflammation, the players that we talked about, the T cells, they go into the central nervous system, They release those proteins that we talked about, the cytokines and the antibodies. That leads to myelin and axon destruction, and that leads to neurodegeneration. So this is all happening on a cellular level. I call it havoc in your house. So you can just imagine if all this is going on in your bloodstream, in your brain, and energy is being diverted to this kind of inflammatory process, just like if you had a cut or a wound or a burn, and all the energy is being diverted to heal that up. This is what's happening in your brain. So if energy is going to that process instead of going to having you be able to go to the supermarket and go to your activities and drive your kids to school and their sports and the various things that you enjoy doing, it's going to manifest as fatigue. And this is a picture of what that looks like. Okay. So all this activity is going on. It's not my role here today to name to you each one of these proteins, what each protein is doing, but this is the kind of milieu or the environment that's happening in your brain right now. All right, so we're looking at this from the inside out. That's the inside out, and then you feel it as fatigue on the outside. So then when you get fatigue, maybe you no longer feel like you want to go to the gym or your PT class and work out. Maybe then you don't eat properly. And so it becomes a cycle in which it starts from the inside, it manifests on the outside, and then it just keeps going round and around. So this was all a discussion of the primary factors, if you wanted to know where I was going with this. These are the primary factors. So we talked about inflammation, how there are players in this, how there are T cells, there are B cells, there are cytokines. These are the mediators of fatigue. Then you get axonal loss. Then you have decreased conduction. And some people even think that the endocrine system is involved. The endocrine system is another system in the body that uses a lot of messengers. And for example, if you've ever taken steroids, there's a kind of an energy that comes along with steroid use. And so we think there might be some role with the endocrine system in causing fatigue, but it hasn't been very well studied. Now let's get to the secondary factors. These are probably more familiar. These are the associated conditions that can come along with anybody. So for example, if you have high blood pressure, or if you have restless leg syndrome, or you have sleep apnea, there are a host of other medical problems that can also create fatigue. There's the part of the MS course that you're in. There's some data, not a whole lot, but that shows, I don't know if you've participated in a clinical trial, you've probably heard of something called the EDSS. And that's a disability scale. A score is assigned based on your whole neurologic function. And there's some data that shows us that people who have a higher EDSS score have a higher level of fatigue. And then there are, of course, the medications that are used. Medications that are used to treat a host of other problems as well as your MS. So the associated conditions include, as I mentioned, lots of different kinds of sleep disorders, disorders of breathing, disorders of abnormal movements of your legs, some just plain old insomnia, you just can't sleep. So of course, if you don't get enough sleep, you're going to feel fatigued. Depression and anxiety, and they're two different disorders, and maybe you'll hear about that in your breakout session, and then pain as well. So all of this can kind of eat away at your well-being. Let's talk a little bit about depression. I'm not going to steal the thunder away from the breakout sessions, but you can't ignore it because it's common in MS, and it can often be mistaken for signs of fatigue. So if you have decreased appetite or you're sleeping too much, that can be a sign of fatigue or depression. And there is this correlation and the working one to the other. Here's kind of a nice little algorithm that, as your treating provider we use. So if somebody presents with fatigue, you're probably going to be asked, do you have problems sleeping? Do you have problems with depression? If it comes out to be depression, we'll treat your depression. If it's a problem with sleep, we'll look at it and try and help you with your sleep patterns. We'll treat cofactors, or maybe have you seen by your primary doctor. We'll think about anemia. We'll think about thyroid disease. We'll think about, your B12 levels. All of this goes into looking and assessing and treating fatigue. Now that we've identified it, so say, a person comes into the office and complains of fatigue and I'm thinking about all this and I'm talking to the patient, I decide, okay, we really need to do something about it. We have not just medicines, but we have both medications and non-pharmacologic methods of treating fatigue. So one of the ways that first come to mind when I'm thinking about fatigue is determining if it's motor fatigue, because as I mentioned in talking about the disrupted signaling, one of the medications that really addresses this is called dalfampridine. Its trade name is known as Ampera, and that's a potassium channel blocker. And that can improve the signaling along the central nervous system pathways. And the way it's used and the way it's FDA approved is to improve your walking speed. So now maybe that makes sense a little bit more to you why you're on that, if you're taking that particular medication, why you're on it, and if you're not, to think about if it would be a drug for you, because that affects that signaling along that axon that we talked about. Okay, here are some of the other medications that we use for fatigue. One of these is called amantadine, and that's an interesting drug. It was started out as a medication used in people who have Parkinson's disease, and it found that people had some increased energy, so we kind of borrowed its effects and we use it from time to time. And here I've outlined the kind of typical doses and some side effects and what you could expect to see if you use a drug like that. Another drug that we often use is called Provigil. Its chemical name is modafinil, and it's actually FDA indicated for narcolepsy, sleep disorders of shift work disorders, and also in conjunction with obstructive sleep apnea. A very similar drug to that one is called armodafinil, and it has the same kind of indications, but people with MS, if we can get these drugs approved for you, there have been at least a small study done that shows it has some effect. Along with those particular medications, ones that I didn't mention, often ones that we use are the stimulants, such as Ritalin or other types of that nature. And they work through what we call the norepinephrine system and dopamine system in the brain. So the non-pharmacologic methods are really can be just as efficacious, and when used in conjunction with medications really provide a lot of relief. There's cognitive behavioral therapy, and hopefully you'll be hearing about that today as well. Relaxation therapy, even doing exercise can make you feel better, and then energy conservation. Occupational therapy is a great resource for learning about energy conservation. And in the hot weather, even though it's, we're still quite in the middle of winter here, you might have used a cooling device, a cooling scarf, and to improve your sense of well-being. And it can also decrease fatigue. So what do we know about cognitive behavioral therapy? It improves your function by changing how you think and by changing your behaviors, and it can be done to target fatigue. Methods of energy conservation include sitting down and planning out your week, pacing your activities, setting your priorities, even using some ergonomics so that you use a chair that gives you lumbar support, using technology, and you'll hear more about that today as well. So in summary, as you saw, from the cellular level on up, fatigue is real. It's not something just in your head. If somebody, if your family members or your co-workers just, don't really understand it, you can tell them with certainty it's real. It's multifactorial, and you can work with your care provider to identify and address its causes. Okay, then, well, thank you for your attention, and thank you very much for your time. Have a wonderful day.